Terrific idea. Now, hopefully, neither you nor anyone in your family will ever need a robotic glove as a result of a traumatic brain injury or maybe a spine injury. However, some people are walking around with injuries suffered decades ago and don't even know it.
Yeah, as more and more it's being discovered about concussions, doctors are finding out that brain injuries we suffered as a child or young adult could have possibly resulted in our brain sort of rewiring itself. Let me explain. I think many of us, especially if we're a little older, can remember getting hit in the head with a ball or falling off the monkey bars at the playground and getting what our parents referred to as a goose egg. You remember that? Did that happen to you? Well, we usually shook it off and went on with what we were doing. Or maybe our parents gave us an ice pack to put on our head. Well, as doctors are finding out, these seemingly minor injuries could cause a lifetime of effects.
As a chiropractor specializing in neurology, Dr. Daniel Lane of Delmarva Chiropractic has seen dozens of patients who have suffered a concussion.
The easiest way to describe it is almost like a brain bruise. The brain tends to move forward and then backward, and it can actually compress into the aspects of the skull, and something they call coup, counter-coup type injuries. You see them in sporting events, you see them in vehicular traumas, you can see them pretty much with anything that might affect the head.
But not all head injuries result in such a bruise.
The current literature is supporting and proving with research that concussion is far more complex and that it affects many areas of the brain.
Dr. Lane says the easiest way to determine if someone has a concussion is with eye movements.
Of course, whether or not they lost consciousness, for how long they lost consciousness, these continue to this day. But it's important to realize that that's very, very, very rudimentary. And so the standardized type of model that they're proposing, and that many institutes are using, the Brain Center that I'm affiliated with, University of Pittsburgh, world-renowned brain centers, use ocular function, meaning eye movements, particularly what is referred to as the latencies of saccades. And so when someone looks from the left to the right, such as that is called a saccade. And the initiation of that movement is called the latency of it, and that is controlled and it is typified by frontal lobe involvement.
Depending on the severity, Dr. Lane says treatment starts with rest.
The protocol that people want to remember is that when you've just sustained a concussion and it hasn't been one that's involved a significant loss of consciousness and that the vital signs are stable and the patient's more or less stable, the standard of treatment is rest. And that's going to be for approximately 7 to 10 days.
In addition to rest, Dr. Lane says you need to change your diet to a high-fat, high-protein, low-carbohydrate or ketogenic diet.
A ketogenic diet is done because most of the time when you've hurt as a concussion, you have a higher level of brain function due to the injury. It seems a little paradoxical, but the frontal lobe largely acts to inhibit or turn things down. And if it's not working very well, you'll start to have what we call escapes, or things revved up, so to speak. And ketogenic diets, ketones, tend to decrease overall function. So that's a nice way that you can just turn down that overactive brain for a bit of time. Again, not forever. With the case of a ketogenic diet, probably 3 to 4 weeks.
But sometimes people don't even realize they have had a concussion until years later. When they come up with symptoms, they may not even connect to an injury that happened in the past.
But what I often see is that the brain, when it has been hurt, will find ways to help get you through, crutches, so to speak. And unfortunately, people don't realize, and hadn't realized until recently with the study of the nervous system, that you could affect many of these pathways that are aberrant and have been hurt, but too many times people don't. And so the effects of concussion can be seen years later, and then eventually, if one part is not working as well as others, there's so many aspects of what we call the neuraxis, or the human being's brain, that are interconnected that you can start to have aberrant functioning in other areas of the brain as well.
Some of those symptoms include vertigo or a sense that the world is moving even when you are not. Dr. Lane says focus and decision-making can be affected too. Dr. Lane says one way to avoid this in the future is to get a baseline functional neurological exam, a way to know how the brain is functioning before an injury.
It's just like your blood work. You know, if you don't have anything from which to compare it, how do you truly know? But if someone had baselines, particularly if you're an athlete, particularly if you're in a school environment, or you're going to be in the type of sport, and that would include the number one sport obviously being football, the number two being women's soccer that have the most amount of concussions, I would behoove parents just have your kids looked at, establish a baseline. That doesn't mean you need ongoing treatment. You just know exactly, get a snapshot of their neurological function. And then in the future, should they suffer a head injury, you can actually see and have a comparative value.
After initial rest, treatment is started. Dr. Lane says a brain injury is much like a joint or muscle injury, and in most cases can be rehabilitated through therapy.
And Dr. Lane adds that a child who suffers a concussion should be taken out of school for at least a week. He says while they're home, they need to rest their brain. That means no video games and no TV. And if you would like to learn more about concussions and Delmarva Chiropractic, go to our website, WBOZ.com, click on our picture at the top of the page.
How about that?
Yeah,
man, oh
interesting stuff.
Yeah. Well, speaking of kids, there are at least 1,000 kids from all over Delmarva that are spending a week away from TV and video games, and they don't mind. Coming up next on Delmarva Live, we're going to take you to Camp Barnes. For nearly 70 years, this camp has given kids, many of whom have never left their own neighborhood, the opportunity to get away and have some good old-fashioned summer fun. You're going to find out how it got started and why it's a Delmarva treasure. Delmarva Live, we'll be right back.